The importance to have an annual health check is that if any time that you feel better, but then something can occur that you don't know that's there, and they can find it before it's too late.
It's known that people with learning disabilities have poorer health than other people in England. A lot of that is due to their learning disability, their communication problems, not accessing services. Annual health checks are invaluable for improving health for people with learning disabilities.
This is my action book, what Jean gave me, for the second one. This is really good. I used to go and get support with my dentist, but now I go on my own. And then get the bus home, and then get the appointment and write in my diary. And I go to the doctors, the GP, and I got treatment for my feet as well.
A positive experience when I went to GP once was when I went there for, I was really anorexic. I was 7 stone, and I really wanted to gain weight, but I weren't gaining it. And I went to the GP, and she spoke to me just really nice and in a friendly way, instead of just oh yeah, you're just another patient. Yeah, I don't really. They proper care for you, and she was explaining, do this, try do that. And then when my mum was oh, protein shakes, so they meant to work and everything, she's yeah, that's fine, but don't worry about it that much, just try and eat a bit more. And I was really happy, and I did gain weight. I'm 9 stone now.
One of the main things they can do is just be welcoming, and a happy smile will make all the difference to an adult with learning disabilities. Obviously, flexible appointment times. If somebody's got anxiety, offering them an appointment at the end of the day when it's quieter, offering quiet rooms, using signage, photographs, maybe even having an open day just to let them get familiar with the surgery and the staff. And one of the main things is just treat people like you'd like to be treated like yourself, and be welcoming, smile, and be patient.
Hello, my name's Sharon, and I have a 13-year-old young man who has additional needs. His name is James, and our kind of experiences over the past few years of going to the GP surgery have not been wholly successful, sometimes due to the lack of understanding of the actual receptionist. Maybe having a smile when we walk into the surgery might be quite nice. The actual GP having some empathy towards the young person. We also have a pain indication chart that we take with us to the GP surgery for James to be able to explain, because he's non-verbal, how and where it hurts him and how much it hurts him.
The first one, when I went with a community nurse, they did my blood pressure, they did my blood tests, checked my ears, my eyes, and that.
Many parents that I spoke to felt that the Learning Disability Health Check was a really positive opportunity for their child. However, they did express concerns and anxieties when they visit the GP surgery, especially around waiting times, having to tell their story over and over again that their child has a specific diagnosis. Many parents saying they're being judged for their child's behaviour because they're not used to the environment and it's not quite suitable for their child's needs. The young people, on the other hand, actually quite enjoyed going to the GP surgeries at times. They found that the GPs, the practice nurses, were really helpful. They'd like them to smile when they walked in the door, but they went there when they really needed help. So they recognised that the GP surgery was a really important part of their health.
When my son was coming up to 16, we had some information come in about the disability healthcare checkups, which I thought would be really, really good for him because he's autistic. When we go to the GP, he hasn't got that verbal to explain what's wrong with him. So I asked the GP and he said he couldn't. The paediatrician had to. I spoke to the paediatrician secretary. They said no, a psychiatrist has got to do it. The psychiatrist said no, a social worker had to do it. And yeah, and then that's as far as I've got really. No, basically, because when he was diagnosed with autism, because the words learning disability didn't appear as a diagnosis, they won't see him, but his problems are the same. He's got a good understanding now, but when it comes to understanding health and things like that, he hasn't got it to understand, and he would need me all the time with him to explain. So in my opinion, he would need that. That one checkup a year could tell me as a parent, and for him, if anything's wrong or anything's going on the wrong side, because he doesn't explain pain either.
I get panicky because of my autism, so it would help for GPs to understand some patients might want to know when their time is ready, because I know the GPs are running late, even though in the morning, when it's like the first appointment, they're always running late, but